Hello everyone and welcome to another episode of Next Saviours Essential Question Series for NEET PG 2025. Today we are going to have a discussion on a very important topic which is related to the sepsis predictions or a multi-organ dysfunction by QSOFA and SOFA scores. You see, for the last 4 to 5 years, you might have seen a question where they are asking the mortality or morbidity prediction in a patient who is suffering from sepsis related to a multi-organ dysfunction, in particular asking about the scoring system, or they might give you the classical clinical features along with the specific organ dysfunction abnormalities, and then they might ask you about the scoring calculation on the basis of which the sepsis is predicted. So what is the topic for today are the sequential organ failure assessment, that is SOFA score, and the quick sequential organ failure assessment, that is QSOFA score. So first of all, we have to start with the SOFA score, which is sequential organ failure assessment. The SOFA score is a clinical tool which is used to assess the organ dysfunction in critically ill patients, particularly in the setting of sepsis and septic shock. Now, it is responsible for predicting the morbidity and mortality in ICU patients with sepsis. So what are the components of this SOFA score? As you can see very clearly, see that there is a involvement of the organ, and on the basis of that organ involvement, the scores are assigned. The abnormalities of the respiratory system, which is identified by the ratio of the partial pressure of the oxygen and FiO2, the cardiovascular abnormalities, which is based on the measurement of the mean arterial pressure and the use of vasopressins, the renal abnormalities, which is based on the creatinine or the renal output, the hepatic, which is based on the measurement of the bilirubin, the coagulation profile, which is based on the platelet measurement, and finally the neurological status, which is based on the Glasgow Coma Scale. So on these basis, the scores are identified and the scores are calculated. And even if the total SOFA score of just more than or equal to 2 indicates an organ dysfunction, which is a key criteria for diagnosing the sepsis as per sepsis 3 definition. And higher the SOFA score, it correlates with a higher mortality risk. Because we are talking or we are dealing with a topic where the definition of the septic shock is also important for you to know. So what is septic shock? Septic shock is defined as a persistent hypotension which is requiring vasopressors and lactate of 2 millimole per liter despite fluid resuscitation, which is often reflected in high SOFA scores. Now, if you go back to the question that we have shown before, that a 65-year-old male with a history of type 2 diabetes, mellitus, hypertension, and a chronic kidney disease was admitted in the ICU for fever, altered mental status, and shortness of breath for the last 2 days. It is observed that the patient is progressively getting confused and lethargic since yesterday. On examination, he is febrile, tachycardiac, and tachypneic. Blood pressure is low, 65 by 60, started on norepinephrine at the dose of 0.08 microgram per kg per minute, which is less than zero point 0.1, which is having a significance in SOFA score for hemodynamic support. Now, he is drowsy and responds to the painful stimuli, but is not oriented to time or place. One of the key finding based on the organ involvement is the provision of the vasopressor addition. Now, laboratory finding, what they are revealing is the involvement of the respiratory system where the PaO2 to FiO2 ratio is less. The serum creatinine levels are high. Total bilirubin is also high. The platelet count is low. So based on the SOFA or sequential organ failure assessment score, what is the total score for the patient? Now, as we have already learned about the SOFA score based on this, so let's assign or let's calculate what is going to be the SOFA score related to this particular question. Now, first thing that is provided to you is the ratio PaO2 to FiO2 ratio is 180 and it is lying in the category of score 2. Now, serum creatinine levels of 3.2, it is lying again in the score of 2. The total bilirubin levels, as you know, it is 4.8, so it is again lying in the score of 2. The platelet counts, which are 85,000 per microliter, it is lying in the score of 2. As far as the neurological status is concerned, now here in the history it is mentioned that he is drowsy and responds to the painful stimuli but is not oriented to time or place. That means the GC score is 9. The score which can be assigned is 3. And finally, the cardiovascular system involvement where the vasopressor is added, and the vasopressor added is within the range of addition of the norepinephrine to less than 0.1 microgram per kg. So the score that can be assigned over here is 3 for the cardiovascular system. So all the 6 organ dysfunction scores can be assigned. So all you are left with is now to do the mathematical calculation. That means 3 plus 3 is 6, 6 plus 2 is 8, 8 plus 2 is 10, 10 plus 2 is 12. and 12 plus 2 is 14. So the correct answer for this question is 14. So hope you have understood everything related to this particular question or the topic, that is SOFA score. Now let's talk about another question that resembles that of the SOFA, but here the patient is not admitted in the ICU. Like 72-year-old male with a history of type 2 diabetes mellitus and chronic obstructive pulmonary disease presents to the emergency department with a complaint of fever, shortness of breath, and confusion for the past 2 days. The patient is being less responsive and disoriented since this morning. And what is being provided over here, that the temperature rates, the heart rate is higher, the blood pressure is low, the respiratory rate is high, and the GCS is 13. As you can very clearly see with the continuation of the question, that laboratory tests and imagings are pending. Bedside assessment raises concern for the sepsis. And as an intern, you were asked to calculate the score based on the Q-SOFA, that is quick sequential organ failure assessment. So now what we are going to learn is the Q-SOFA. It is the quick sequential organ failure assessment which was introduced as a part of third international consensus definition for the sepsis. That means sepsis 3. For you to provide a simplified method for early sepsis detection, especially in the setting outside the ICU. The quick sequential organ failure assessment is a bedside tool actually, which is used promptly to identify the patient with suspected infections who are at increased risks for poor outcomes. So how the Q-SOFA scores are calculated? The Q-SOFA score assigns 1 point for each of the following criteria, like low blood pressure, that means systolic blood pressure of less than 100, 1. Increased respiratory rate more than 22, 1. Altered mental status means any change in the mental status. Even if the Glasgow coma scale is less than 15, then it is assigned as 1. So that means you can very clearly say that the Q-SOFA score of 2 or more, it points towards the onset of infections and is associated with a higher risk of adverse outcome and suggests that the patient may be experiencing sepsis. On the other hand, this tool, as we came to know, is particularly valuable in the emergency departments and general hospital wards where the rapid assessment is crucial and extensive laboratory tests might not be readily available as it is mentioned in the question. So as you can see over here, that when you assign this 1 for the blood pressure, 1 for the respiratory rate, and 1 for the Glasgow coma scale, then the score is more than 2 and the answer for this question is 3. So by this time, you already might have recognized that what are the differences in between the SOFA and Q-SOFA and why Q-SOFA is important. So if we talk about the differences, as we have already learned, that what is the purpose? It is for the assessment of the multiple organ failures in the ICU. And here the purpose for Q-SOFA is the bedside tool for the sepsis screening outside the ICU. What are the number of the systems assessed? In case of SOFA are 6, while in case of Q-SOFA, it is just the clinical assessment of 3 organs. As far as use is concerned, the SOFA is used in case of ICU, but Q-SOFA for the emergency and the ward patients. Now, the topic shouldn't be ended at this point because once you are aware of that the patient might be suffering from the sepsis, in order to reduce the mortality, it is essential for you to start a structured approach to the sepsis management, and that is achieved by sepsis bundle. So what is sepsis bundle? It refers to a set of time sensitive and evidence based intervention that must be initiated within the first 1 to 6 hours of recognizing sepsis or septic shock. Now, these bundles are designed to reduce mortality and improve the patient's outcome. And the latest surviving sepsis campaign guidelines recommend the 1 hour sepsis bundle, which is replacing the previous 3 hour and 6 hour bundles for more rapid intervention. All you have to do or proceed with in the first hour is to measure the lactate levels. If initial lactate levels are more than 2 millimole per liter, then repeat it after 2 to 4 hours. Now, why lactates are important? Because elevated lactate suggests tissue hypoxia and poor perfusion. Then you have to obtain the blood cultures. Now, two set of the blood cultures from two different sites, both aerobic and anaerobic, are to be acquired. Now, also obtain urine, sputum, or wound cultures if at all they are relevant. In case if you are not getting the culture, so do not delay the antibiotics for the culture. If the cultures are getting delayed, so start antibiotic as early as possible. So what are the schedules for the antibiotics? Obviously, these are going to be empirical antibiotic therapy, and that has to be initiated within the first hour. So empirical therapy, which is based on the suspected source, you have to initiate with the piperacillin, tazobactam, vancomycin, or meropenem. If extended spectrum beta lactamase is suspected, which is due to the resistant hospital acquired infections more commonly. For community acquired pneumonia, ceftriaxone and azithromycin, UTI with sepsis is suspected than cefepime or meropenem. Intra-abdominal infections are suspected than piperacillin, tazobactam or meropenem are the broad spectrum antibiotics that you have to initiate within first hour. Next is rapid IV resuscitation that has to be initiated within 1 hour. So all you have to start with is 30 milliliter per kg IV crystalloid over the first 3 hours. Now, what you have to monitor the lactate, the blood pressure, the urine output, and the mental status. And finally, vasopressors have to be started if hypotension persists after IV fluids, because the goal is to maintain the mean arterial pressure of more than 65 millimeters of Hg. So, what is the first line drug? It is norepinephrine. In case of refractory shock, add vasopressin. If the cardiac dysfunction is suspected, then start dobutamine in order to improve the cardiac output. Now, what are the additional interventions which are needed to be taken beyond first hour bundle? Are the oxygen therapy or mechanical ventilation, if at all indicated. Second is the steroids, if the shock persists despite fluids and vasopressors. In case you have identified that infected lines or the drain abscesses or the surgical debridement might be the source, so it has to be controlled early. Then monitor the glucose, because the target of 140 to 180 milligram per deciliter has to be achieved, and start insulin if at all required. Renal support by monitoring the urine output, and dialysis might be required if there is a worsening of the acute kidney injury. And finally, the DVT and stress ulcer prophylaxis using heparin and the proton pump inhibitors. So these are the additional interventions which are needed. Why the sepsis bundle is important? As you know that early intervention, it significantly reduces the mortality. And if there is a delay of every hour in antibiotic, then it increases the mortality by almost 8%. Lactate clearance, as you know, we have talked about this, it correlates with improved survival. And fluid resuscitation with the vasopressor support, it prevents multi-organ failure. So hope you have understood everything related to this very, very important topic. We are expecting this question to be asked in this examination also. So be ready for these kind of the questions. In case you don't want to miss any update, then join our Telegram group. The link is provided in the description. All the best.